You know, we've interviewed so many of the wonderful physicians with Bienville Orthopedics here on the Mississippi Gulf Coast. Today we're talking to a spinal specialist, Dr. Joseph Cox. How are you, sir?
Hi, good. How are you?
I'm well, thank you very much.
Thanks
if you
for having
would,
me.
Well, thank you for being on here. I mean, we've talked to so many different doctors, Dr. Lewis, Dr. Karpyskaya, and so many more that I can't remember them all, but it's just really interesting to find the different things that you work on in your fields. We're going to talk about yours in just a moment, but first tell us a little bit about yourself.
Sure, yeah. So I'm originally from Birmingham, Alabama. I did my orthopedic training in Dayton, Ohio, at a very busy level 1 trauma center, and then made my way down to Dallas to do a spine fellowship and trained with some unbelievable world-renowned surgeons. And I really got exposed to some of the most cutting-edge technology, including the spine robot that's here on the Gulf Coast. And actually, one of the gentlemen that I trained with helped develop that. Also got exposed to motion preservation technology, and really just helped develop my passion for treating the spine. So,
Now, and that's your specialty, the neck,
yes, sir.
and the spine, and general orthopedics.
Yes, sir. So my everyday life is taking care of patients and their spine problems from basically the base of the skull down. So neck and back is definitely included. And then I also do some general orthopedics. So
How long have you been with Bienville Orthopedics?
This is my 3rd year now. So,
Yeah.
you know,
What type of, you're talking about your specialty is spine. What type of conditions, types of neck and back conditions do you treat?
yeah, so probably the easiest way to say it is arthritis of the spine, and that encompasses so many different nuances of what's going on. So degenerative disc disease, there's these little joints we call facets that can wear out, but essentially it's wear and tear of the spine, and that can happen in your neck, it can happen in your low back most commonly, it can happen in your thoracic area as well.
Now, as far as the back, those are some of the most common conditions and problems that you can find. And I guess does it just happen over deterioration over a period of years, or can it sometimes be genetic?
Sure. Absolutely. So the things that we do with our bodies, so our environmental factors, genetics plays into it too. We have to think about just the general health of your back. We think about our blood pressure and other medical conditions often. We don't think about the health of our bones or our joints as often.
Right. Until we start getting older, then we can't move as easy as we used to.
Right. So thinking about our joints, our weight, exercise, eating right and avoiding things like smoking.
Right, right. What are some of the symptoms? I mean, if someone's wondered, well, I wonder if I have back problems, or what are some of the things that might have those little telltale signs that I might need to go see a specialist?
Yeah. So back pain in general is almost ubiquitous. Everybody, well, 80–85% of people are going to have severe back pain enough in their lifetime to actually miss some work. So it is a very common thing. Most back pain and neck pain can be lumped into it. Will go away with a little bit of time and conservative measures, but if you're taking some anti-inflammatories, you're trying to be active and stretch things out, and it's just not going away, that's a good time to call and make an appointment.
Yeah, I know a lot of people think that they can use that as a so-called bandage, taking anti-inflammatories or something, and when you're only probably compounding the problem.
Sure.
I'm sorry, I was going to say, how do you determine between using surgical techniques and non-surgical techniques?
Yeah, so again, most of these pains are going to improve with some time, just like most other injuries. But if we're giving it time and we're trying those anti-inflammatories and we're trying to stretch things out with some therapy and they're not getting better, then sometimes we need to entertain a surgical option.
Now, as far as the surgery, can you use the robotic tool to work on the spine?
Absolutely. So it's a pretty amazing invention that's relatively new, and I think we've got a lot of fantastic technology that's going to come out of it. But
now, is that the Da Vinci unit?
So it's a bit different than the Da Vinci. The Da Vinci, I'm going to overstep my bounds maybe a little bit, but it's more abdominal.
Yes, okay.
In its use, but the ones that are available for spine usage right now are the Excelsius robot and the Mazo robot.
That's probably working on the spine. It's got to be a little bit more fine-tuned because that's a pretty sensitive area with, I mean, with all the joints and the nerves that go through the backbone, because that's kind of a key part of our skeletal structure.
Absolutely. So very important that we pay a lot of attention to doing things right and not having complications. I think the robot is a really good tool that we can use in addition to a lot of other technology, but I do think that it's translating into faster recovery and getting people back to doing what they want to.
I was about to ask that. Using the robot,
Yeah.
does it relate to a quicker recovery time for the patient as you know, general surgery used to be?
Yeah, I think that there are many instances where it does translate into patients having a smaller, I guess, smaller damage to the tissue as you're doing your surgical approach, and that translates into less pain and less days in the hospital, and just ultimately feeling better quicker.
What about the neck? What kind of situation do you deal with the neck?
Well, the robot specifically isn't approved by the FDA for use in the neck, but I think the neck is a really fantastic area for motion preservation techniques. So this includes arthroplasty, so just like we replace a knee joint or a hip joint, we can actually replace the disc in your neck. And so what that does is it helps with preserving the motion of that one segment, and what we know is that when you fuse it, that's the other option when you need to treat the neck surgically, so fusion versus arthroplasty. And by going with arthroplasty, you're going to offset the stress on the other levels, which you wouldn't do with a fusion. And actually, we find that we believe that it decreases the need for future surgeries.
And of course, I'm sure you deal with that with people who end up with whiplash in an accident or something, or it's strained the neck.
Yeah. Accidents happen every day, and you know, we try to avoid those. But when they do happen, I think we've got techniques that can get people back to life.
What are the different locations here on the coast that y'all have?
Yeah, so me personally, I come to the Biloxi location and the Gulfport location, and I'm happy to see patients from anywhere, though.
Do they need a referral from a general practitioner?
They do not. They can call and make an appointment with Bienville without a referral.
Okay, and you're taking new patients?
Yes, sir.
Okay, always. And as you mentioned, there are a few locations here on the Gulf Coast where we are today at Cedar Lake. You have the one over in Van Cleve. And then
we have one on Dido Road in Gulfport.
Dido Road in Gulfport. Okay. Dr. Cox, thank you for your time. And
right, thank you.
Another great interview with one of the great specialists that they have at Bienville. And of course, I mean, you know, if you need a referral, you can just you know, see your doctor and make an appointment. Numbers on the bottom of your screen to get some relief, whether you have neck issue, back issues, or any orthopedic issues. Give them a call at Bienville Orthopedics.